We need to do better. We all need to do better. We need to do better not just for cancer patients, but for their informal carers. Now, when I say informal carers, that's just a really fancy way of saying you and me. Husbands, wives, brothers, sisters, mothers, best friends. We need to also do better for that person. We need to do better for that person who provides love and support for that person as they go through their cancer journey, because we know that person will really struggle. I want you to do something for me, okay? I want you to get right in the front of your head and picture, now not your kids, right? But I want you to picture that person that you love most in the world and put them right at the front of your head. Now, if you're having trouble with this, this is probably the person that you also find particularly irritating, yeah? This person that you really love, but you're not that fussed on, yeah? That's your person, okay? So, I want you to think that your person hasn't been particularly well for a little while, okay? And today, you both are going to go to the hospital and you're going to get some results. And there's part of you that's thinking, you know what, today we're going to get to the bottom of this and we can get on with our lives, but there's also part of you today that's really, really worried. And you set off and you navigate your way through the multi-story car park, the things that ruin many relationships as you try to park and you critique each other's driving. And you make your way to the waiting room of that hospital. And you settle down on the plastic chairs with you and your person. And if you're anything like me and the people I love, we can talk about everybody in the room with just raising our eyebrows. We can diagnose what they're all in for just by kind of looking to the left or right, and we can have a full conversation. So you do that as well when you're sitting on the waiting room and you take out your phone and you have that moment. But as you sit there, I want you to think about your person's name, and it's just being called out. Your person. And you make that walk past the chairs to the doctor's office, and she says those words. It's cancer. Now, those words, of course, will have a huge impact on the patients. I am not taking that away, it really will. But that will also have a huge impact on you. Physically, psychologically, and socially. And as we conduct our research, we have found that our health service won't necessarily catch you. You won't be provided the support that you need. As a reader in support of cancer care here in Queen's University Belfast, I've been really interested in that. I've been really interested in understanding the impact that a diagnosis of cancer can have on the informal care. And I have to share with you that the results are not great. If you care for somebody with cancer, your health will or can be affected physically, psychologically, and socially. And what we find is these significant impacts are not short-lived. They can hang around for months. They can hang around for years. Carers get sick. Okay? Now, when we found that out, we wanted to talk to healthcare professionals all across Northern Ireland to try to understand what can we do differently. And healthcare professionals, they didn't disagree with us. They says, absolutely, the carers that have told you that story, it's correct, it's right. They said that we work in a service that's so stretched, that's so under-resourced, that in that 10 or 15 minutes, I have to focus on the patient. I can see that that person who is sitting on the chair next to me, I can see that they've lost weight, that they have black bags around their eyes, that they don't seem to be absorbing what I'm saying. I can see that they're struggling. Healthcare professionals agree. But they say we need to think differently. In a service that is lacking in resources, we need to think differently about how we can bring carers along. How can we support carers? Now, as I tell you this story, is this only in Northern Ireland? And the answer is no, absolutely not. Here in Queen's University Belfast, we conduct a program of research that's international. We have traveled from Vietnam to Australia to Angola to Uganda, and the results are the same. Cancer carers are really struggling, and the health service is not picking up their needs. Let me share with you two stories thousands of miles apart, but it'll show you two carers that are really struggling. Has 61. She's Vietnamese. She's a rice farmer, and that is what she does. That is what she knows. Has daughter, is in her 20s, and hasn't been well for a little while. Has daughter has a huge mass on her breast. Ha packs up those belongings, both hers and her daughter's, and she makes the hundreds of kilometers journey to Hanoi, the big northern capital of Vietnam. And when Ha arrives there, she's overwhelmed. The crowd, the noise, trying to navigate a hospital that she doesn't understand. Her daughter's there, and because of the lack of resources, she shares a bed, a hospital bed, with 3 other women. Ha must stay with her daughter. She cannot leave. She cannot go home because there's nowhere there to wash, change, feed her daughter. Doctors are saying words to her like chemotherapy and radiotherapy and lymph nodes, words that she doesn't understand. But Ha needs to make decisions. Ha's really scared and alone, and nobody's picking up her needs. But you know what? Most of all, Ha's just a woman who's standing there watching her daughter die, and she's doing that alone. Travel back to home, and I want to tell you about George. And George has been married to Susan for 15 years. They went steady for years before that, but they eventually got married. And George and Susan, they have 2 gorgeous wee girls, 2 wee firecrackers. And George is self-employed. And George is trying to navigate the way between being self-employed, taking care of his girls, supporting Susan, and being big and brave and telling everybody that everything is going to be grand. But you know what? At 11 o'clock at night, when George is standing ironing the uniforms alone, he cries. And he cries because he wonders how he's going to take care of 2 wee girls without their mommy. Now, I know that I've presented this problem to you, but in a health service that's really stretched, why should we care for the carers? Why is that important? And I tell you this, because carers get sick. If we do not take care of the carers, we are kicking the can just down the road. Our health service needs carers. We won't function without them. We need them happy. We need them healthy. We need our carers. And you know what else? Carers and patients' health are directly related. They correlate. If we have healthy carers, we can also improve the outcomes for patients. Now, as I stand here today, I'm not going to say that I have all the answers, because I really, really don't. But I can say that COVID-19 has given us an opportunity, okay? It's told us that people are willing and able to engage in online and digital solutions. Our healthcare professionals told us that they're stretched, that they're under-resourced. Carers tell us that they need something. Digital resources can help. And George, he told us that on a Thursday, he can't go see a counsellor at 3 o'clock because that's the time he gets the girls. Or he can't do it at 5 because that's when he makes a dinner. And he can't do it at 7:30 because that's when Susan's really tired and he needs her. She needs her. She needs him. So digital solutions, what George wants is supports at 11 o'clock at night on his phone, on his knee, when he can access at a time that suits him. So let's be big and brave and bold. So if you're a carer here today, I want you to know that you're important. I want you to know that taking care of your health doesn't make you bad. It doesn't make you selfish. It actually will make you a better carer. And if you're a healthcare professional sitting here today, in the 10 or 15 minutes that you have, 30 seconds could make a huge difference to that care. So as I've talked today, love does really hurt. It does. But love can also really heal. So as we work as a globe together to help tackle cancer, to help to get a strategy for cancer, let's wake up. Let's make carers part of that solution. Let's make carers visible. Thank you.